Hello and good afternoon. Welcome to today's COVID-19 update with the county's public health experts, coming to you from the safety of their private offices. Today you will hear from the county's Director of Public Health, Dr. Von Do Reynoso, and Dr. Henning Ansorg, the county's public health officer. Following their updates, we will open it up to questions from the news media. This press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Kim Rich. Videos of the press conference will be available shortly after the conclusion in English and Spanish, posted on the county's YouTube channel at CSBTV 20. And with that, I will turn it over to County Public Health Director, Dr. Von Do Reynoso.
Good afternoon and happy Friday to all of you. I'd like to start with some slides. Great. So it is indeed a happy day because we are reporting 61% of Santa Barbara County residents over 16 years of age have received at least one dose of the vaccine. However, older age groups have a greater vaccine coverage. We are finding that among 65 and above, over 8 in 10 have received at least one dose of the vaccine. And among 16 to 29, unfortunately, only 4 in 10 have received at least one dose of the vaccine. So now that vaccine supply is plentiful, you can grab an appointment anywhere in our county. Everyone 16 above is eligible. It is critically important for you to make your vaccine appointment as soon as possible. Next. Of the 346,580 doses received in the county, 164,380 first doses have been administered, 120,210 second doses have been administered, and the single dose Johnson & Johnson 10,526 have been administered. So in totality, we have administered 85.2% of what we have been allocated, and we have the remaining 14.8% committed towards appointment. Next. As I mentioned earlier, based on the eligible Santa Barbara County residents, 16 years of age and older, 61% have received at least one dose of the vaccine, and 45% are fully vaccinated. So congratulations, and I appreciate everyone who has taken that step. Next. We anticipate a change in eligibility as soon as the end of next week. We anticipate that community members 12 years and above will be eligible for the Pfizer vaccine. And so community members 12 plus years of age can get vaccinated at any vaccination clinics that are using Pfizer. Next. First and second doses remain available countywide, really widely available. So please get your appointment. You can get your appointment using myturn.ca.gov. If you have issues using MyTurn, please call us 211, select option 4. We are also offering walk-in appointments, or actually you don't need an appointment, you can just walk in at any of our county public health vaccine clinics and others as well. Pharmacies are offering walk-ins, and other clinics throughout the county with hospitals and community centers are also offering. So I encourage you to visit our website so that you can see where all the opportunities lie. Next. I'd like to share the progress of our mobile vaccine program. So far, in the 3 weeks that we have been in operation, we have booked 58 sites, and the sites include agricultural work sites, community centers, community-based organizations, faith-based settings, low-income housing. We've been in shelters. We've been in centers serving people living with disabilities. We've been in centers serving people in treatment or recovery. We are expanding our sites to include farmers markets, swap meets, and open air markets. And again, these sites will not require an appointment. So if you see us at the farmers market, swap meets, or open air markets, or anywhere in any of these sites above, please grab your shot. If you are a community organization or employer and you would like to book a mobile vaccine clinic, please contact us at mobileclinic@sbcphd.org to schedule your vaccine clinic. Next. I want to begin acknowledging all the partners in our county who have been vaccinating our community. And we'll be starting to do this at our press conferences and at our Board of Supervisor briefings. This week in particular, because they are leaving, I would like to pause and thank the 97 plus vaccination team members sent to us from the state. These individuals have been working at our HRSA equity pods in Lompoc, Santa Maria, and this week in Santa Barbara. They've been here in our county for the last 6 weeks. Their efforts contributed to our county reaching our vaccination metrics of the 61% eligible population with at least one dose. And so on behalf of the county, on behalf of the department, I'd like to thank everyone for their service to our Santa Barbara County as they head on out to other places or towards their home. Next. I'd like to end with a strong encouragement again for community members to get vaccinated if you have not done so. Meanwhile, everyone continue to wear your mask, safeguard your social distance, and get tested if needed. Thank you. And with that, I'd like to introduce you to Dr. Ann Sorg, our County Health Officer.
Thank you, Dr. Dorinoso. Good afternoon, everyone. Over the past 2 weeks, the age groups with the most positive COVID results in Santa Barbara County were the under 18-year-olds, followed by the 20 to 30-year-olds. We have seen several outbreaks at various high schools across the county. Most of them were related to student athletes, but also to some unsanctioned parties and social events. Unfortunately, only 40% in that age group are already vaccinated. We are anticipating for the FDA to grant the emergency use authorization for the Pfizer vaccine to become available to all children 12 and up as soon as this coming Thursday. Having students vaccinated will greatly improve their safety, and it will help the whole community to get closer to a state of herd immunity. Later in September, we are hoping the Pfizer vaccine to become available for all children 2 years and older. We are already collaborating with UCSB and the local colleges to help them getting all college students vaccinated before the beginning of the next semester. We are very fortunate to no longer experience any shortage of vaccine supply. Our large-scale vaccination sites have been very successful, and we are now concentrating our efforts on hard-to-reach communities, homebound individuals, and employer-based and church-based, school-based, and other sites by sending mobile vaccination teams out to vaccinate people. Remember that fully vaccinated people are able to safely mingle with other vaccinated folks, even indoors, without social distancing or mask wearing. That is in private indoor settings. If you are fully vaccinated and you go to a restaurant or you are in public transportation, we ask you to still wear your mask. called OSHA is the regulatory agency responsible for workplace safety. They are slated to convene on May the 20th, and they will adapt their regulations regarding safety precautions at work sites in alignment with the new CDC and CDPH recommendations on mask wearing, social distancing, and vaccination status. Due to our statewide low case rates and high vaccination rates, we are already able to move around and socialize safely with less restrictions in place. The Public Health Department is very grateful for the support we have been and still are receiving from our community members in making Santa Barbara County a safer place. We are about to enter a transition phase in the pandemic, where public health mandates and health officer orders will be replaced by recommendations and advice on safe activities. This change may feel a little uncomfortable to some and likely couldn't come early enough for others. Rest assured that we, as the Public Health Department, we will continue our efforts in monitoring our local virus activity very closely, and we will continue to provide guidance on how to remain safe as a community. Thank you for your cooperation.
Thank you both. And now we're going to questions from the media. First up is Blake Devine with KYT. Blake, go ahead.
Hi, guys. First, I just wanted to clarify. So 61% of Santa Barbara County residents over 16 have received at least one dose. And then of those, is it 45% are fully vaccinated of that 61%? I just wanted to clarify with those numbers.
Blake, you've got it perfectly.
Perfect. I guess my next question is, how many weeks now have we been in orange, and have we hit a yellow criteria yet? Because obviously I know we need to do it 2 weeks in a row in order to get into the yellow tier. Have we gotten numbers that put us in the yellow thus far?
Unfortunately, no. Our current case rate hovers anywhere between 3.8 and 4-ish. And so we don't anticipate qualifying with our case rate for the yellow tier in the upcoming week.
Okay. And then I guess going along with that, just speak to what is it going to take to push us into the yellow tier? Because obviously it's the least restrictive tier, and we've had a lot of progress, but it feels as if we've kind of stalled off where we're hitting numbers around the 20s and 25s and 30s each day. What is it going to take to get to that yellow tier?
That's the $1 million question, Blake, and a good one. I think from my perspective is we know safety precautions can get us to reduce the case rate. And that is the masking, the social distancing, and now the vaccination rates. So I would say that we need to continue doing what we know, and what we're not doing enough is getting all of our community vaccinated. And I don't know when we will reach the yellow tier, but given that, as Dr. Ansorg just mentioned, given the June 15th deadline of lifting the tiers, I'm just not sure if we will get there. We need to double down and get vaccination rates up, and continue meanwhile to practice that masking and social distancing.
Thank you. And then I guess the question for Dr. Ansorg is, could you just speak a little bit more about, right now we're in that phase where everyone that really wanted a vaccine has pretty much gotten it, but right now we're dealing with getting those people that are hesitant and trying to get them to receive the vaccine in order to move to that next phase. And could you just speak a little bit about why people that are hesitant should get the vaccine, I guess, for the greater good of the community and just also keeping people safe?
Yes, I mean, you worded it perfectly. It's basically to get vaccinated has a huge impact on the person, on you personally. And it will keep you safer. You will be able to enjoy more socializing in a safe manner. But also for the community as a whole, it increases our common immunity, also known as herd immunity. And that is a big factor in a virus outbreak. The more people are vaccinated or immune, the less likely or the more difficult it is for the virus to find new patients, new victims, so to speak. And so I would encourage everybody who is on the fence with the vaccine, please reach out to me, to your primary care providers, go to our website for information, rely on really good and solid resources like the CDPH websites or the CDC web pages on vaccine safety. It is a surprisingly safe vaccine. We are really fortunate to have this available at no cost to us and also without any scarcity anymore. As you heard earlier, only 40% of the young people are vaccinated. And I really want to plead to everybody in that age group between 16 or as of next week, 12 up to 40 years, please roll up your sleeve. You can walk up to pharmacies and to our vaccination sites and get the shot.
Thank you so much.
Thank you, Blake. We have a lot of hands raised. So next we're going to Erin with KSBY.
Thanks so much. I know, Dr. Armando Reynoso, you already answered this, but can you please reiterate how many people are partially vaccinated, excluding Johnson & Johnson?
We have 61% of our eligible Santa Barbara County residents 16 years of age and older have received at least one dose of the vaccine. And that does include the Johnson & Johnson.
Okay, that does include it. And then my second question is there a database to track who has received a vaccine?
Can you tell me more?
So I'm wondering about people who walk in for the mobile clinics. How can you ensure that they get their second dose? Is there a way that people track who comes in, especially for just walk-ins?
Oh, absolutely. So when you walk in, you don't have an appointment. An appointment is not necessary, but we still register you. So you do enter into the care database. And when we also will tell you when the next appointment will be, when we will be back in that same location to make it easier for you.
Okay, and thank you. And my last question is there a place where I can find where the partially vaccinated percentages are excluding Johnson & Johnson? Is that on the website?
You can find all of our data and information on our website under the vaccination tab. And if you can't find what you're needing, please feel free to reach out to us.
Thank you.
Thank you, Erin. Next up, we're going to Tom Bolton with NewsHawk, who will be followed by Jade with NewsHawk.
Good afternoon. My first question is a follow-up on Blake's question about the yellow tier. It sounds like it's predominantly the youngest age groups that are preventing us from advancing, and I'm wondering what specifically is being done to address those populations in terms of both their behavior as well as the vaccinations.
Great question, Tom. So what we have done is partner with community organizations to do the mobile clinics where it's convenient for younger people. For example, yesterday we partnered up with UCSB and we were on campus giving via our mobile clinic, and we're able to vaccinate at least right under 300 individuals. And so we will continue doing that in offering pop-up vaccination clinics in Isla Vista. In combination with that, we are pushing out specific messages to that age group via social media and continuing to partner up with everyone else to reach out to this group.
Okay, thank you. It's been reported that there's been a rising number of no-shows for people getting their second doses. And I'm wondering how much you're seeing that happening locally and what you're doing to address that.
So locally, we track our own numbers, and from the public health sites, we're seeing a 7% no-show, and that's remarkably less than what we are seeing across the country. So what we are doing is our call center is reaching out to all of those individuals and to assist them to schedule appointments. And we have success in doing that. I know that other providers are doing the same when they review their records and are finding individuals that haven't gotten their second shot. They are reaching out to them and via emails, via phone calls as well. I think that it's safe to say that everyone in the healthcare system in our county are very vested in making sure that community members are coming back to get their second dose. And we are doing calls, we are doing emails, we're reaching out to make sure that that happens.
What are the implications if someone doesn't get the second dose?
I think that that individual is not protected as they can be, and they are more at risk of getting a COVID-19 infection, and it would be worrisome, especially we know that with the variant circulating. So the best is that individuals, our community members, complete their second dose.
Okay, thank you. I have one other question. San Luis Obispo County announced today that early next month it would be discontinuing its large-scale vaccination clinics. And I'm wondering if you can tell us what the expectation outlook is for those clinics in Santa Barbara County.
So we have our large mass vaccination clinic at the end of this week. What we're finding out is that the mobile clinics are needed now to make sure that it's available in communities, in places that individuals are comfortable getting their vaccination shot. So I anticipate that we will go to a smaller clinic model, more specific to communities. And in addition to that, we will be thinking about how we are going to vaccinate school age community members, since the 12 and above will quickly become eligible next week. We are planning in the planning phases, but again, when we move towards vaccinating school-based clinics, it'll be on a smaller scale than what you have been seeing, the 2,000 plus appointment pods.
Is that likely to be at school sites, or do you really know at this point?
Some of it will be at school sites, and some of it will be at community sites. Some of it will be in a central location. So we're finding that it's not one plan, one model, but we're creating different clinic models to make sure that everyone gets served.
Okay, thank you very much.
Thank you, Tom. Next up, we're going to Jade MartinezPogue with News Hawk.
Hi, thank you. We've been getting a few questions from readers, and I was just curious if you guys had any plans for mask mandates for outdoor activities like sports and summer camps following the CDC's updated mask guidelines.
Yeah, I can take a stab at that. Jade, the mask mandate for outdoor activities for unvaccinated people, if they cannot socially distance, is still in place. So we also have school guidance that has to be followed by summer school and summer camp activities.
Okay, thank you. That's it.
Thank you, Jade. Next up, we are going to Atmica with the Daily Nexus.
Hi, hope everyone's having an awesome Friday. I have a few questions. My first one is, how did the mobile clinic at UCSB go, and are there any plans to do more in the future?
It went well. We were expecting about 300 appointments to be given, and we came right under that. I think it was really a lot of heavy lifting by UCSB to get the students to come and get vaccinated. So I'm sure that moving forward, we will have more vaccination clinics. And we are also exploring doing mobile clinics in Isla Vista with other partners as well.
Thank you. And that kind of leads me into my next question, which is public health currently working with any community stakeholders to approach vaccine hesitancy in Isla Vista? And I guess a question a little bit prior to that one is, do you believe there is a vaccine hesitancy problem in Isla Vista?
I would say I'm not sure if it's hesitancy or if it's a question of convenience. And so I want to remove the barrier if it's a convenience issue with our pop-up mobile clinics. With regards to hesitancy, we are working with our team, our communications team has been working with UCSB and other partners just to push out the messaging about the critical need for everyone who is eligible to get vaccinated.
Are there any specific cultural organizations that you guys have been working with, or any churches or other groups within Isla Vista?
We have not worked with specifically with cultural groups in Isla Vista or churches in Isla Vista, but that's a wonderful idea. We will take that under consideration and explore that.
Thank you. So my next question is about traveling. I'm so sorry. only have a few more, I promise. But so we're heading into the summer, and people are going to be traveling. And even though we're seeing great numbers here, that isn't necessarily true nationally and also globally. Are there any concerns about global travel over summer, and the possibility of other mutations coming back to Santa Barbara?
Yes, let me take a stab at that. Absolutely. Unvaccinated people are really at great risk, especially if they travel overseas into areas where we see a lot of newer and more rapidly spreading variants of the virus type. We would encourage you to get vaccinated before you travel. That will also relieve you of the need to quarantine upon return. So it makes traveling really much safer and less cumbersome for the traveler and for the whole community. So that is my advice, strong advice, to get vaccinated before traveling.
Thank you. Are there any concerns, or have we seen any data to suggest that the variant detected in India is in Santa Barbara as well?
Yes, we have seen sporadic cases of the variant. However, the variant was tested and did not fulfill all the requirements for this really rapidly spreading virus variant in India. So, because we only test a small percentage of positive test results through the state and through our UCSB lab, we do not have an exact number of how much of this variant type is currently circulating. But to answer your question, yes, we have seen it. Not very predominant here, but we have seen it.
Awesome. Last two, I promise. So you just said numbers, gave us some numbers that really honestly gave me a lot of hope, which is that 61% have at least received their first shot, which is actually, and correct me if I'm wrong, says that we're kind of nearing that 75% mark, which is like the lower end of what people use to determine herd immunity. So my question is, based on like current rates of how many people want to get vaccinated, when do you anticipate that we will reach that 75% mark?
It's very difficult to predict, and the reason the 60 or 61% of at least one shot in the arm is actually across the state, and that's why we see cities like Los Angeles and San Francisco being in the yellow tier. The only way that that's possible is with a really widespread vaccination uptake. And I think that that's been the main reason why California is faring well, because the vaccination effort has been really tremendous and quite successful. So yes, I just plead and urge everybody who's on the fence and who just hasn't made up their mind to please go ahead and get vaccinated, which will get us closer to this elusive herd immunity. But I wish I had a better prediction, but that's where it is.
Thank you. Last question. If people ages 12 to 16 will soon be eligible, I know that I think you need, if you're a minor, you need approval from your parent. And it's also recommended that a parent accompanies you. Are there any other guidelines for the newly eligible group?
The trial data have shown that it's really well, the Pfizer vaccine is very well tolerated in the younger age group. And for the 16 years and older, actually a parent does not necessarily have to accompany. A written consent is sufficient. With regard to the younger 12 and up, we are in communication with the state public health department. We will come up with a uniform consent form and best practice of how to ensure that parents are on board with their kids getting vaccinated. So that will be coming as soon as next week.
Thank you, Atmika. And next we're going to Laura Place with Santa Maria Times, who will be followed by Fabiola Navarrete at Two Tiempo Digital.
Hi, everyone. Thank you, Gina. I was hoping you could clarify, Dr. De Reynoso, you said there's a 7% no-show rate so far in the county. Was that specifically for second dose appointments or just appointments in general?
Thank you, Laura. That 7% is referencing the no-shows for second dose in public health community vaccination sites, not countywide, just our sites.
Oh, thank you. Do you know what the no-show rate is at those sites just for first and second dose appointments? Is it any higher or is it kind of the same?
Great question. I don't have that information, but that is really worthwhile to pursue. So we'll be able to update you with that in the next few days.
Okay. And as far as mobile clinics, since you've opened them up to walk-ins, not just appointments, have you seen them being filled anymore? I know it was kind of difficult to fill them up for a time there. So has that increased at all?
With regards to bookings or with regards to no-shows at our mobile sites?
Oh, I mean bookings. Like, have there been more people attending those clinics to get vaccines?
Yes, we have found, and what we are hearing is people marveling at the convenience of the mobile clinics. It's at their space, whether it's living space, community, or at their work site, or at their college. So we are finding out that individuals are really taking advantage of the opportunity to get at the convenience of our mobile clinics. clinics. And we also have found that when we were at the swap meets or at that it was super convenient. People were thinking about getting vaccinated, hadn't had time to make their appointment, and we were there. So they seized the opportunity and got vaccinated. So we are seeing that more and more people are utilizing it, and more community partners are booking those clinics.
Okay, thank you. And just looking at kind of the ongoing gap there is in vaccination rates between North and South and Central County, it looks like that gap is still pretty big. Like, and maybe some of that has to do with days where there are mass vaccination clinics taking place in one area and not another. But for example, like yesterday, there were 1,700 people who got vaccinated in South County and only 800 in North County, or actually 100 in North County. So I was just wondering if you're, with that gap continuing and even getting worse, is the public health department considering any other ways to address, that disparity? I know it's you all are working hard to reach communities, but are beyond the mobile clinics, are you thinking of other strategies maybe?
Yes, I was just on the phone with 4 partners in Mid-County and North County to walk through what it would look like if they were engaged with us in the outreach effort and we do the vaccine clinic. And so I'm happy to report that all 4 partners are fully engaged and are equally concerned about that disparity as well.
Okay, can you tell me who the partners are?
Until they sign on the dotted line, I'm reluctant because we are still, they are conceptually in agreement, but until I see the paperwork, I don't want to jinx it.
Oh, okay, no worries. All right, thanks very much.
Thank you, Laura. And next up, we're going to Fabiola Navarrete with Tu Tiempo Digital.
Hi, everyone. Good afternoon. Okay, my first question, this is a question from the owners of businesses. They want to know if in the near future will be mandatory that the employees get vaccinated.
As long as the vaccine has emergency use authorization by the FDA and is not fully FDA approved, it is not legal to make a vaccine of that status mandatory. Having said that, Pfizer actually has applied to receive full FDA approval. We do not know exactly how long this process is. It could be months long, and that would definitely change the landscape. But as it stands right now, employers cannot mandate to get this vaccine. They can recommend it, but they cannot make it mandatory.
Okay, thank you. My next question is regarding to mobile clinics. We want to know how has been the response from the agricultural workers, if they are getting vaccinated or they are hesitating. Do you have this information, Dr. Bando Reynoso?
Yes, I would say that the majority of our mobile clinics have been utilized by our ag sector. We are on a routine basis visiting our growers as well as our H2A housing. And we continue to partner with community-based organizations in Santa Maria, particularly, to ensure that farm workers have access to vaccinations.
Okay, thank you. And my last question is about this Mother's Day weekend celebration. What can you advise our community about celebrating this special occasion?
Sorry, you broke up a little bit. Do you mind repeating?
Oh, sorry. Okay, this is about the Mother's Day celebration weekend that is just here. That what can you advise our community about, social gatherings and celebrations for this event, for this moment?
Yeah, of course, that's, highly anticipated and waited for. If people are fully vaccinated, they can, in their own home, they can receive other fully vaccinated people, obviously, without mask wearing, without social distancing. They can also receive one unvaccinated household safely without masking and social distancing. And that is especially important for children who cannot be vaccinated at this point. Now, having said that, with our beautiful weather here, outdoors is of course a different scenario. Even unvaccinated people may gather outdoors, but we ask them to wear a mask if they don't socially distance. If they stay away 6 feet or more from each other, they do not need to wear a mask, even if they're not vaccinated. So I think it will open up a lot of opportunities to meet mothers and grandmothers this weekend.
Thank you. Okay, that's all. Thank you so much.
Thank you, Fabiola, and everyone. That actually concludes today's press conference. Just to let everyone know that the Board of Supervisors is in session this coming Tuesday, which will include a COVID-19 briefing with our public health experts. And also to let everyone know that now that we are in orange and we're looking pretty good, our press conference schedule is going to be bi-weekly, which means our next press conference will be May 21st. However, each day and each week, we have other ways of also receiving updates. You can watch for the live updates every Thursday at 11 a.m. on KEYT News Channel 3. And then also daily reports are posted on the county's public health data dashboard and in other sections on our extensive website at publichealthsbc.org. So with that, we wish everyone a safe, healthy, and happy weekend. And of course, happy Mother's Day to all of our moms. Thank you and have a good night.